Picture a sterile hospital ward in the 1970s, cold floors, uniform beds, and the quiet hum of early medical machinery. In one of these rooms lies a patient facing a catastrophic medical emergency, deeply unconscious and unresponsive to the world around him. On a completely separate floor of the hospital, the attending psychiatrist, Dr. Bruce Greyson, sits down to grab a quick meal. He accidentally drops a bit of sauce on his tie and immediately buttons his lab coat to hide the stain so no one will notice. The next morning, the patient wakes up. When Dr. Greyson visits the room, the patient describes the hidden sauce stain perfectly. He also repeats the exact private conversations Greyson had with colleagues on that completely separate floor. This diagram shows how remarkably common this phenomenon is. 1 out of every 10 people who face clinical death reports a near-death experience, recalling vivid events they couldn't possibly have seen while unconscious. As a patient's physical body is shutting down and their eyes are firmly closed, we have to ask how their mind is perceiving the outside world with such intense hyper-awareness. When we look at the biology of dying, the process begins with a severe drop in blood pressure. The patient's breathing becomes extremely shallow, requiring an oxygen mask just to maintain minimal respiratory function. As oxygen levels plummet, the body loses control over basic reflexes in the mouth and throat. This creates a physiological bottleneck, rapidly cutting off the remaining oxygen supply to the heart. The patient slips into a deep, painless unconsciousness. Without oxygen, the heart inevitably stops beating, leading directly to total organ failure. But medical data reveals a strange delay. For approximately 30 seconds after the heart flatlines, the brain remains active and fully aware. The medical monitors show a biological machine that has stopped working. Yet, inside that final 30-second window, the patient's subjective mind begins an intense journey. According to researcher Dr. Thomas Fleischmann, who has studied thousands of these cases, the mind navigates 5 distinct stages while the body fails. It starts with a sudden rush of peace and a complete absence of fear. Shortly after, patients report the sensation of their consciousness detaching, floating above their own hospital bed. From there, the clinical environment fades away entirely. The patient transitions into a realm of complete, comfortable darkness. A warm, highly attractive light appears in the distance, forming a tunnel. The floating observer feels drawn forward into the glow. About 10% of survivors reach the final stage, stepping into a vivid environment filled with vibrant colors and music. Here, they often report meeting deceased relatives and experiencing rapid flashbacks of their entire lives. A cold, failing biological system sits on one end of the spectrum, while a rich, hyper-real landscape exists on the other. The dying brain is somehow generating a profound sensory experience while entirely starved of oxygen. This diagram highlights the temporoparietal junction, or TPJ, located at the back of the brain. In a healthy person, this region maintains our spatial awareness and tells us where our physical body ends and the outside world begins. When severe oxygen deprivation hits, the TPJ begins to malfunction. The cells fire erratically, creating intense sensory glitches. Without a functioning TPJ to map physical boundaries, the brain loses track of the body. This specific neurological glitch generates the clear illusion of floating near the ceiling or moving through a tunnel of light. Far from a supernatural crossing, this vivid afterlife journey appears to be the brain's highly creative method of processing its own shutdown. Neuroscience gives us a mechanical explanation for the internal hallucinations, but it still cannot explain how a patient like Dr. Greyson's could accurately describe a sauce stain on a totally different floor of the hospital. That specific mystery is exactly why researchers at the University of Virginia continue to study Dr. Greyson's anomaly alongside thousands of similar cases today. Their work points to human awareness being surprisingly resilient. The brain can continue to process ambient sounds and events even when medical instruments declare a patient clinically unconscious. The biological shutdown is absolute, yet the mind continues to observe and process for vital seconds after the heart stops. The transition from life to death is a highly complex biological event, and we are only just beginning to map its boundaries.